Hi, I'm Jeff. I'm a student athletic therapist here at Mount Royal. What's your name?
Ryan.
Nice to meet you, Ryan. So I see you, I got a note from the orthopedic surgeon saying that you had your right scapular fracture about 5 weeks ago,
Yeah.
and you've been doing some range of motion exercises for treatment?
Yeah.
Perfect. Okay, so we're going to work with you today. Like I said, it was 5 weeks since the last time, since the initial injury. So what we're going to do today is we're going to do some exercises to help promote strength, build up some range of motion in your shoulder. Yeah, really see where you're at and see what we can help out today.
All right.
Would you like to proceed with treatment?
Yes.
Perfect. Okay. And it's your right shoulder?
Yeah.
That's the problem. What I get you to do first is I'll get you to stand up, just over here. And the first thing I want to check is your, and notice there's some notes about scapular dyskinesis and maybe abnormal setting in the scapula, so I want to check that first. Make sure that's one of the first things we correct if possible, and address the rehab goal of increasing helping with your posture, which will help with your overall range of motion.
Okay.
So the first thing I'll get you to do, if you don't mind taking your shirt off, just so I can see what your shoulder blades are doing, and what I'll get you to do is just face that direction for me. And the first thing I want you to do, because there's a note about flexion being abnormal, is the first thing I'll get you to do is bring your arms up with your thumbs up. Just bring them up in front of your body as far as they go. So I notice a little bit of wing more on the right shoulder than the left. What I'd like you to try to do, just bring your arms back down again for me. What I want you to do is when you bring your arms up, I want you to try to pull, sorry, my hands are cold, pull your shoulder blades back and in. So almost like you're tucking them into your back pockets. So if you can, I'm going to put my fingers here just to help with, provide some sort of feedback that you can use. So I'm going to put my thumbs here and I want you to pull back just a subtle movement on your lower shoulder blades. And then I want you to do the same movement with your thumbs again, trying to keep your shoulder blades back. Good, and back down for me. Good, that was a little bit better. So the next one I want to get you to try to do is, instead of out to the front, I want you to try to bring your arms out to the side as far as they go. So just like this. Back down. So that was pretty good. Your scapulas, where your shoulder blades are pretty set with that one. So that's going to help with our goal of posture and keeping those back. So the other thing I want you to do throughout the day is just keeping those scapulas set. So if you say you're sitting at a desk throughout the day, something like that, what I want you to do is an exercise where you'll be sitting kind of, if you're bent over at all, I want you to try setting those shoulder blades back and holding that for about 3 to 4 seconds. So you'll do 10 reps of that and 3 sets. So can I see you do the first set for me? So what I'll get you to do, same thing as before, if my thumbs are on your shoulder blades, and then just pulling your shoulder blades back and holding for about 3 seconds. So 1, 2, 3, and then relax your shoulders. And then again for me. And relax. And you'll do that 10 times. Good.
That's fine.
Perfect. Okay. So the next one we're going to do, the next goal we're going to address, to help with this will help with your range of motion, because you've been immobile for a while. What we're going to do is try to do a stretch for your upper traps. So what we'll be doing for this one, if they're tight at all, what you can do is you'll sit on your hands. Then what you're going to do is bend towards your opposite side. So you go to your left shoulder first, and you're just going to hold that for 30 seconds. So you can try that for me, please. Do you have any pain when you do that?
No.
Okay. Let's stick with this one. So let's do this. I want you to do it twice a day. So if you're sitting at your desk at work, something like that, you can do this at work and just hold it for 30 seconds. Do both sides so that you get even stretch between them.
Okay.
And you'll do 3 sets back and forth. Sound good?
Yeah.
So that's going to help with your range of motion at your shoulder and around your neck. What I want to do for some other range of motion exercises, I see you've done some passive range of motion so far. So what I'd like to start incorporating is a little more active range of motion. So especially where you don't have complete abduction and extension yet, I want you to do the exercises that we went over, keeping your scapula set. So if you want to stand up for a second for me, what I'll get you to do, the same exercises that you were doing before with your shoulder blades set. I'd like you to just go through your active range. So keeping in pain for your range, just going through as far as you can. So what you're going to do first is the flexion. So you're going to go forward until you start to run the pain. Back off a little bit. And then you're going to hold that there for about a second. Deep breath. And then back down. And then you're going to do it again. Do you have any pain when you do that?
No.
Okay, so we're going to add that one. What I'm going to get you to do is also 10, so we'll do 3 sets of 10 reps per day of that one out in front, and then you'll do the ones out to the side as well. So same thing as before, hands under shoulder blade set, and then you'll go hands out to the side. You're keeping within your range, just take a deep breath at that when you get to the top, and then come back down. So you'll do 3 sets of 10 of that. Okay. Which you did. The important thing that we're also going to address is kind of the psychological component of rehab with this. So when you're breathing, try to breathe in instead of just through your chest. Try to work on abdominal breathing, taking deep breaths through the stomach. This will help relax your sympathetic, activate your parasympathetic nervous system and help with any tension that might be building in the system.
Okay.
So can you try that again for me? By try to breathe through your chest, or your stomach almost, instead of your chest when you do these, when you take the deep breath at the end. Good. Does that feel any different?
No.
Okay. Let's try to add that one then, and we'll add that to your exercise as well to get the psychological component we have. What I want to do I noticed earlier when we tested, actually let's test it again. You seem to have some problems with external rotation in your shoulder. So what we're going to do is we're going to use an EMS machine to actually help with the neuromuscular activation and helping provide that sense of feedback for your body. So what I'm going to do, I'll get you to hold this with your left hand. And what I'm going to do is I'm going to place the pads around the rotator cuff. I'm going to place the pads around the rotator cuff on the external rotators in the rotator cuff. what I'm going to set it on is basically what I want to do is provide some neuromuscular feedback so that your muscles kind of have a stimuli that activates them, essentially, and helps assist with movement where it might be limited. Initiate that movement of external rotation. So what I'm going to set it at is on a duty cycle of 10 second on time and 10 second off time. I'm going to put it on 30 hertz. I'm going to use a 1 second rep, and I'm just going to turn up the NEMS once I clear the contraindications first. Do you have any pacemakers or anything like that? Or any electrical implants or metal implants at all?
No.
Okay. Have you ever used NEMS before?
No.
EMS? Okay, so basically what it is we're using electricity to help send a stimulus to the muscle to get the muscle to fire. So it shouldn't be painful, it might be an uncomfortable feeling, is what we're trying to do basically. To stimulate the neuromuscular control is we're basically taking the muscles to complete tendons or complete contraction. So it might feel uncomfortable because we're trying to get the muscles to fire basically to the maximum potential.
Okay.
But if it feels uncomfortable at any time, you can stop. Just tell me and I'll shut it off for you. So what I'm going to set it on, I'm actually going to use a duty cycle of 1 to 5 ratio of off to on time to maximize the muscle contraction and take it to tetany and complete fatigue. So I'm going to turn it on, and then what I want you to do is you'll just keep your elbow bent, and then you'll feel the contraction pull, so you should feel pull on your arm to go out. When you feel that pull, after I turn it on, just kind of go with the movement and during the duration of off time. So what I'll do to start